Oral Microbiome, Hygiene and Health is a first edition published in 2025 by CRC Press, part of the Taylor and Francis Group, and edited by Rajesh Kumar and Shamsher Kanwar. The book belongs primarily to the field of oral microbiology, with connections to periodontology, oral medicine, preventive dentistry, and systemic medicine. It is intended for researchers, dentists, oral health specialists, physicians, and other healthcare professionals. The 19 chapters progress from the composition of the oral microbiome, biofilm, and nutrition, through infections and antimicrobial resistance, to cancer, systemic diseases, probiotics, pediatric health, and diagnostic methods. The structure is logical, but this is neither a conventional clinical textbook nor a guideline. It is an interdisciplinary collection that examines oral diseases through biofilm, dysbiosis, host response, and interactions within the microbial community. This is its greatest conceptual value. The authors emphasize that the microbiota is specific to both the anatomical site and the individual, and that disease cannot be reduced to a single bacterium. In dental caries, for example, the book states that Streptococcus mutans and lactobacilli alone do not explain the disease and that a broader microbial community participates in its development. This perspective is clinically useful because it shifts the focus from eradication of pathogens to control of biofilm, diet, environmental acidity, saliva, and patient behavior. The scientific foundation is broad but uneven. Some chapters use systematic reviews, meta-analyses, randomized controlled trials, and studies published as recently as 2024, whereas others rely on narrative reviews, laboratory models, cross-sectional studies, and older sources. The book itself acknowledges that findings in oral microbiome research are often inconsistent because of differences in methodology, sample size, and lack of standardization. The chapter on diagnostics further highlights problems with the standardization of sampling, deoxyribonucleic acid extraction, and sequencing, as well as the fact that a sample obtained at a single point in time has difficulty representing a dynamic microbiome. This is an important professional message. A technologically sophisticated result is not automatically a clinically valid test. It is also appropriate that, in periodontitis, clinical examination, periodontal probing, radiographic assessment, and medical and dental history continue to be presented as the foundations of diagnosis, while microbiological and molecular tests are considered adjuncts. For everyday clinical practice, the strongest recommendation in the book remains control of oral biofilm. Regular oral hygiene, mechanical plaque removal, control of risk factors, and dental checkups have a substantially stronger clinical basis than attempts to define an ideal microbial composition for every patient. The book recommends reducing free sugar intake and gives a threshold of less than 10% of total energy intake. This is consistent with the recommendation of the World Health Organization, which advises keeping free sugar intake below 10% of total energy intake and preferably below 5% to achieve a further reduction in the risk of dental caries. Another important topic is probiotics. The book presents laboratory research and randomized clinical trials involving gingivitis, periodontitis, and dental caries, but in some places it concludes too definitively that certain probiotics are effective in preventing caries. At the end of the chapter, the authors are more cautious and state that long-term clinical trials are required to scientifically confirm their actual role in the prevention and treatment of oral diseases. The European Federation of Periodontology does not establish probiotics as a standard adjunct to subgingival instrumentation and emphasizes that adequately powered multi-center randomized controlled trials are needed before such approaches are incorporated into clinical guidelines. Probiotic modulation of the microbiome should therefore not be presented as a replacement for standard periodontal therapy. The third key area is the oral-systemic relationship. The book describes bacteremia, systemic inflammation, and microbial translocation and discusses associations with cardiovascular disease, diabetes, rheumatoid arthritis, neurodegenerative diseases, and malignancies. The strongest sections explicitly caution that correlation does not imply causation and that shared risk factors may explain part of the observed associations. Independently, a scientific statement from the American Heart Association published in 2025 confirms an association between periodontal disease and atherosclerotic cardiovascular disease, as well as biologically plausible mechanisms, but states that causality has not been established and that well-designed longitudinal and randomized controlled studies are required to determine whether periodontal treatment improves cardiovascular outcomes. Precisely for this reason, some formulations in the book are overstated. One chapter concludes that improved oral hygiene may effectively reduce the development or spread of cancer, even though immediately beforehand the authors acknowledge that data on the association between microbiota and cancer risk are limited. Another associates twice-daily brushing with fluoride toothpaste and daily interdental cleaning with a reduced risk of oral cancer. Good oral hygiene is an important health recommendation, but the sources presented in the book do not justify presenting it as a proven specific measure for preventing oral cancer. The fourth important area is antimicrobial resistance. The chapter provides a good explanation of the mechanisms of antibiotic action, horizontal gene transfer, and the development of resistance, and identifies excessive and inappropriate antibiotic use, improper prescribing, and self-medication as important causes of the problem. However, for dentists, this section serves more as a microbiological explanation than as a prescribing guide. It does not provide sufficiently clear algorithms for indications, drug selection, duration of treatment, and situations in which antibiotics are unnecessary. This section should therefore not be used as a substitute for contemporary therapeutic guidelines. The fifth topic is microbiome-based diagnostics. Salivary biomarkers, sequencing, proteomics, and metabolomics are presented as promising, but the book simultaneously acknowledges problems with validation, standardization, and the lack of large reference databases. At present, this remains primarily a research field rather than a replacement for standard diagnostic methods. The book has four major strengths: interdisciplinary integration of oral ecology with general health, a clear explanation of biofilm and dysbiosis that is useful for understanding dental caries and periodontitis, broad coverage of emerging diagnostic technologies and biomarkers, and inclusion of topics such as antimicrobial resistance, phage therapy, and personalized medicine. Its weaknesses include an uneven level of evidence, the absence of formal grading of recommendations, repetition of topics, and occasional progression from biological plausibility or statistical association to an excessively strong clinical conclusion. The chapter on vegan diets is particularly problematic because it makes broad claims about reducing the need for medications and about a future in which fruits and vegetables will become the primary means of prevention and treatment instead of medications or surgery. Such claims go beyond the evidence on the oral microbiome presented in the book. For dental students, the book is good supplementary reading, but it is not a first textbook in cariology or periodontology. For dentists at the beginning of their careers, it is useful if they are able to distinguish experimental findings from clinical recommendations. General dentists will benefit most from the chapters on biofilm, nutrition, antimicrobial resistance, oral systemic relationships, and diagnostics. Residents and specialists in periodontology, oral medicine, and oral pathology, as well as university faculty and researchers, are likely to gain the most from the book. The book is less helpful for selecting specific therapeutic procedures and managing complications. It is more practical for risk assessment, prevention, patient education, and understanding the biology of disease. The three most important professional messages are these. The oral microbiome should be viewed as a dynamic ecosystem rather than as a list of good and bad bacteria. An association between the microbiome and systemic disease is not proof that modifying the microbiome prevents or treats that disease. And emerging diagnostic and probiotic technologies are promising but do not replace clinical diagnosis, biofilm control, sugar reduction, and standard therapy. Does the book deserve a place in a professional library? Yes, primarily as a reference and supplementary resource. I would recommend it most strongly to colleagues interested in biofilm biology, periodontology, oral medicine, microbiology, and research. A dentist looking for a procedural manual for everyday clinical work can reasonably skip it. Its greatest value lies in its breadth and in connecting oral ecology with contemporary biomedical research. Its greatest weakness is the inconsistent distinction between a promising hypothesis and clinically confirmed benefit. It is better suited as a reference manual and supplementary resource than as a clinical guide. Is it worth the time required to read it? Yes, but only if it is read critically and its most ambitious claims are not automatically converted into recommendations for patients.